Hello viewers, I'm Mr Silwaba, your host, and then today we're going to do temperature, pulse, respirations and BP. So those are called vital signs. So that's our topic for today, vital signs. So those signs are life and death. Okay, so you need to know how to conduct vital signs. So under vital signs we have temperature, pulse, respirations, blood pressure. So you can call it TPR BP. So before we do the TPR BP, you need to know that we've got certain instruments that we use. Okay, so here with me we've got a thermometer. So this is a mercury thermometer, meaning it has mercury inside there. And then this part is shaded so that you use it when you want to visualize. So this part has to go on the other end so that you see from here. Okay, so this is thermometer, mercury thermometer. Okay, so then the thing is that you cannot just say you're doing temperature without knowing the normal ranges. So the normal ranges for temperature, which is core temperature, when you put it in the armpit, which is auxiliary temperature, we can call it core temperature or auxiliary temperature. So for that one, it's you can say the range is 35.5 to 37.2. Then other books would say 36 to 37.2. So depending with the book, but at least the range should be there. So that's the normal range for temperature. So you just want to measure the hotness or coldness of the body. Then you go to, which is the P. The P is pulse. So pulse rate, you don't need the instruments which are here. Pulse rate, you're going to just get your fingers, but not your thumb, of course. You put it there on the radius. Okay, so you can call it radial pulse. Okay, so there are different spots where you can get this pulse. You can get it from the carotid, you can get it from the femoral, you can get it from the most local. You can just say most of the times we want you to get from the radius, which is radial pulse. But if it's in resuscitation, adult resuscitation, you go to the carotid, not on the radio. So there we are going to see the technique as we demonstrate. So you're going to put your fingers on the radius there and then feel that pulsation or the distension. Therefore, we can say that pulse is the wave. So it's a wave of distension, okay, which is felt after the heart pumps or the left ventricle pumps blood to the rest of the body. Okay, you're going to feel it there. And then you cannot feel it in the vein because veins, mostly they've got valves and obviously the blood is sluggish, but you feel it in an artery. Okay, so that's why you go there. And again, the normal range, because you cannot just do pulse without knowing the normal range. So the normal range for pulse, so literature would say 60 to 99 beats per minute. So that's 60 to 99 beats per minute. So you can have that range. Then other books would say 60 to 100 beats per minute. So that's the range. At least in that range, then you can say you're doing pulse or you are taking a pulse, and then that's a normal range. So when pulse, say it's below 60, if it's below 60, that's brady. So it's bradycardia. Okay, it's a bradycardia. So that's below 60, bradycardia. Then when it's above 99, which is 100 and above, we call it tachycardia. So tachycardia. So that should bring some concerns when it's tachycardia, because a patient can go into fibrillations, or sometimes you can call it ventricular tachycardia or fibrillations. Okay, so there are such kind of abnormalities. So that's why it's important to take pulse, because you want to know how the heart is beating. Okay, so there should be that range. Okay, then we go to respirations. Respirations, we want to see the rise and fall of the chest. So you need to count the number in which the chest will rise and fall. So the chest, we can say, will rise and fall in 1 minute. We can say about 12 to 20 in an adult. 12 to 20, some books will say 12 to 24. That's the normal range, meaning you want to see how many times the chest will rise and fall back. Okay, so you cannot count to say when it rises 1, when it falls 2. So you just have to count maybe say the rising, which is 1, 2, 3, 4. So you just want to see the rising. So you cannot count to say 1, then count another one, 2. No, just the rising, which is 1, 2, 3, until you reach a minute. Okay, so you want to know in a minute. Then there are dangers. If the pulse is not between 12 and 24 or 12 and 20, there are those dangers where we say if it's below 9 or 9 and below, you say bradypnea. Okay, bradypnea meaning this patient is not even able to at least supply enough oxygen, or is not able to get enough oxygen or air in a minute. Because imagine they breathe less than 9 breaths per minute. So meaning they breathe like 1, again, 2. So in a minute, meaning there isn't enough air which they are able to inspire or expire. And again, when it's tachypnea, which is above 30, tachypnea, the patient will be like, so meaning that way this patient is not able to take in enough air or even remove carbon dioxide out. So that's also a problem. That's why it brings you to issues of taking this patient on mechanical ventilators because of such. That's why we're saying vital signs are very, very important because of such kind of issues. But you have to go deep and read, because there are many more things that are attached to vital signs. Okay. So from respirations, we move to blood pressure. This is just a summary or just something to give you an idea. But there is more to vital signs which you have to study. So let's look at blood pressure. Blood pressure, you can either take it using a digital machine, digital BP machine, or you can use a cardiac monitor to get your blood pressure, or you can use a sphygmomanometer. Okay, so you can use the sphygmomanometer. This one uses mercury. So sphygmomanometer uses mercury. So you'll be able to see what it does. So let's just maybe say we learn more about blood pressure. So blood pressure, why should we be concerned about blood pressure? So blood pressure, this is a force, just as it says, blood pressure. So pressure, we're going to say it's a force. So the word pressure, we're going to say it's a force. Now this force, where? Then it's related to blood. So if it's related to blood, meaning we're going to say blood pressure, so the force exerted on the walls of the blood vessels, okay? After the left ventricle ejects blood. So when the left ventricle ejects blood, then this blood will go into the blood vessels. Then that blood will exert a certain force, like that, an outward force on the blood vessels. Then that's the pressure that we want to get. So then why is it important to get blood pressure? Have you seen patients maybe with stroke? And then those patients we call hypertensives. Those patients meaning they've got abnormalities with the cardiovascular system, which is the blood pressure. Meaning there should be a range in which blood should, or maybe blood should exert that pressure on the walls of the blood vessels. There should be a range. So there should be some force which is said to say this force is exerted on the walls of the blood vessels, meaning it's normal. So we can call it systolic and diastolic. So if you look at systolic, that's the upper. If you look at the ranges, that's the one which is on top, and then dash, then another digit which is the diastolic. So on top is systolic. So that's systolic blood pressure. This is when the heart is pumping. So that's the one which we pick on top. And then when the heart has paused or relaxed, which is just within milliseconds, that is diastolic, which is when the heart has just relaxed. But it pauses in milliseconds, so it's something which is very small. Okay? So that pressure. Then the systolic, then the range should be 90 to 140 in some literature. 90 to 140, meaning that's the pressure which is acceptable to be exerted on the walls of the blood vessels. Anything above 140, the pressure of blood in the walls of the blood vessels, meaning it will do something, it will have an effect to the blood vessels or the organs. So that's why you find maybe a rupture in the brain, or maybe something, maybe necrosis or tubular necrosis to the kidney because of too much pressure. Okay, so there are those effects. Or maybe you may find a defect in the eye. Okay, the blood vessels which are in the eyes will have a defect because the pressure is too much. Okay, so it's above 140. So you can say 90 to 140, that's acceptable range for the systolic. The figures on top. Then when it says slash, meaning the figures on the bottom there, which is diastolic, meaning there should be an acceptable range as well, which should be 60 to 90. So 60 to 90 is also acceptable. Now imagine diastolic has shot, it has gone up above 115, meaning that's not normal. Again, the effect will be on the organs because that pressure is too much. The blood vessels are overstretched, so meaning the pressure is too much. So that's why we need to take caution, and that's why we need to know how to do these vital signs, because there are a lot of effects which come as a result of these vital signs. So vital signs are vital signs. Let's know how to take them. So here we go. Let's look at the sphygmo. The sphygmo has got this button. We're going to shift it either off or on. Okay, so when it's off and then you try to pump there, the mercury won't rise. The mercury will not rise because it's off. But let's try to say we take it on there, we turn it on. What happens? Meaning again the mercury is not rising, so meaning there should be a button somewhere or a knob somewhere. So this knob here will be able to control. You close it like that because they have turned it on, but still you try to pump, nothing is happening. You are pumping, nothing is happening. So let's see what happens. Let's close the knob here. The knob has been turned on, meaning it's blocked. Then let's pump. So as you can see, the mercury is rising. Okay, so that's the technique. Okay, so you need just to know how to use it. The knob will close and then this will rise. And the way about when you open the knob, air comes out, meaning the cuff will be deflated. Okay, the cuff will be deflated. Let's close again. We see. Okay, so meaning the cuff there is also being pumped. This cuff, as you can see, it's being pumped. Then the mercury is rising. Then this has been closed. Now let's try to open slowly. We see what happens to the mercury. Let's try to open the knob. Then we see what happens here with the mercury. Let's see. So you see, the mercury is going down, meaning this is open, and then you can hear something like shh, meaning that's air coming out. Okay, so air has come out. So that's what we do. Okay, so now let's try to do on an actual patient. Okay, let's do on an actual patient. So I've got a patient here with me. We are going to do vital signs. Okay, so my patient here, I take it I don't know her names and everything, so I have to go to the patient. Good morning.
Good morning.
Okay, my name is Silwaba Collins, meaning you have to introduce yourself. Okay, so that's after you've done your hand washing and then you come here. Okay, so what are your names? Okay, she's Miss Kasapo. So this is Miss Kasapo. Miss Kasapo, I would like to do vital signs on you. So vital signs meaning I have to take your temperature, I have to do your heart rate, meaning I have to know how your heart is running. Then I have to do your respirations, meaning I have to check how you're breathing. And I have to do the blood pressure to know how much your heart is pumping and how your blood vessels are responding. So I have to explain a bit in simple language. Okay? So the first thing that you do, Ms. Kasapo, can move closer. Okay. So Ms. Kasapo has moved closer. Okay. So I'll have to get the thermometer. Okay, I have to choose. So this is the thermometer I will use. Okay, don't get light from there. So just have to, and then your finger is showing, and then you block the mic. Yes. Okay, so you have to get the thermometer. So when you get the thermometer, you have to put it like this. Then you see the level of mercury. So if you can see like that, at least you see the level of mercury. Mercury is there. That's mercury there. So you can't use it like this. You have to shake it. You have to shake. Then see again. Okay. So as you can see, mercury has gone back into that line there. So mercury has gone back there. So that's mercury. So it has gone back. Now you can use it. So before you insert it in the patient's armpit, there are things that you're supposed to do. First of all, need to get a dry swab and ask the patient to swab the armpit. Since they can be able to swab the armpit. So Mr. Sapo, you can swab your armpit. Okay. There, as you can see, she has swabbed the armpit. Then you get it on a receiver. Okay. Get the swab on a receiver. Then before use of this thermometer, you're supposed to at least get cool boiled water. You put it in that galley pot. Okay, this is cool boiled water. In that galley pot, just a little. Then you get methylated spirit, which is here. Methylated spirit. You put in that galley pot. Okay. Then the first thing that you do is to get a swab. Since you are inserting it into the patient's armpit, you go in cool boiled water. So you get cool boiled water. Then the principle still stands. Is it cleanest to deadest or deadest to cleanest? So before use, you have to start from there. Okay, from the bulb and go up like that. Okay, then you discard. Then you ask Mr. Sapo to insert it, or you can insert it. So this is how you put it. Then you just put. Okay. So it's there. While it's the temperature is being taken, you need to do other things as well. So you can do other things like taking the pulse rate or the respiratory rate. So at this moment, I have to go and take the pulse rate. So the pulse rate, you're going to locate the radius. So this, where the thumb is, this is where the radius passes. The bone called the radius. So you go there. Then where you see this bone prominence here, where the bone prominence here is, that's why you now put your fingers like that. Okay. Then you test. Okay. Then after testing, you can either put the patient's arm like that, so that you do two things at a go. When you place it like that, then you can get the pulse and the respiratory rate. So you can get this arm because our thermometer is here. Okay, so you can get it like that and place it here. So again, the thumb is here, the bone prominence is there, and you go just there. Okay. So when you're comfortable that you can be able to feel the pulse, then you place the arm like that. Then you get your wristwatch or your nurse's watch and then count for a minute. Okay, so you need to start. So I've started counting. Okay, so we have counted for a minute, and after that you continue with the respirations. Don't remove, so just look at the rising of this arm like that, but don't tell the patient that I'm counting. So just leave the fingers there, but then start counting the respirations. So you need to see the rise and fall of the chest, but you just count one time, 1. So we got 2, 3, 4. As you can see, the chest is rising, so you need to count for a minute. Then after having done that, so you know to say the pulse rate is 65, the respiratory rate is 18. After counting respiratory rate in a minute, pulse rate in a minute, then obviously 3 minutes has passed. So you need to get your thermometer. Okay? So 3 minutes has passed, so you need to get your thermometer, then you have to view it like that. So as you can see, that's the mercury, this brown or grayish thing here. That's the mercury here. Okay. So the readings are here. So this is 36.5. Okay. So again, before you put it back, you need to shake it. You need to shake it like that. Okay, and place it back there. But then before placing it back, you need to get spirit now. Okay? That's spirit. So then this part is the dirtiest. When starting, you started from the bulb going up. So you start from there in a circular motion, then come down like that. And put it back. Okay, so at this moment, we have done temperature, pulse, and respirations. So if you can't master, you can write it down. Okay, you can write it down if you can't master. That's temp at 6.5 degrees Celsius. Then pulse rate, which is PR, say 65 beats per minute. Respiratory rate, we've counted 18 breaths per minute. Then what about now the BP, which is the blood pressure? Okay, so we need to, now the thing is that we need to find a table so that we go down to where the patient is, or a chair. Okay, so that we do it nicely. So let me just get a chair. Okay, so it has to be at the level of the heart, somewhere there. So at least somewhere there. It's okay. Here we go. So it will be a little bit uncomfortable, Ms. Kasapo. Okay. Because it will be tightening up, so it will be a little bit uncomfortable. So just have to bear with us. There's a little bit of pain. So even get your stethoscope. Now before using the stethoscope, you need to clean the earbuds with spirit. Okay, so you need to go there. One swab, you throw. Then another swab. This other side, you throw. So meaning at least it's safe to use. And I can put it right there. And then the same technique we're showing you, ensure that the knob is closed. Okay. Then the switch, which is here, is turned on. The switch has to be turned on. The knob is closed. Then you have to feel for the pulse here. Okay. You have to feel for the pulse. So let me feel as I start pumping. At least I've felt it's pulsating already. It's pulsating, so now I have to pump so that where it stops pulsating, that's where I'll start measuring from. So it's pulsating, I have to go. So it has stopped pumping already, so I can at least put some more, so about 10 millimeters of mercury. So then from there, I can put the stethoscope. Okay, then I can start opening slowly. I can be opening slowly, so the mercury is dropping. So as you can see, the mercury is also bouncing, I can see. So if you want to be sure, at least do it twice. So you can lock again and pump. Go up to where you stopped filling it. Then again start. So the mercury is dropping. So it starts bouncing again there. Then there it goes quiet. It reduces in the intensity of sound and then it has gone quiet. So at least the strongest beat was felt around 110 millimeters of mercury. So that has to be the systolic. Then at least that strong beat was began to fade around 90 somewhere there, but then became like can say the sound reduced drastically at 80, and then here it became quieter and all that. So you can say the blood pressure is 110, which is systolic, over 80, which is systolic 110, diastolic 80 millimeters of mercury. So you can put it there. Okay, so this technique you need to practice so that you can learn how to use the spig. Then after use of the spig, you need to close here. Okay, you need to ensure that there is no air left in the cuff, and then you need to close that side so that you turn it off, meaning you have finished using. Then what about the stethoscope? Stethoscope, you used it, it was in your ear. So you need also to clean it the same way you did when starting. So you get spirit, swab, throw, swab, and throw. Then here, you need to document again. So blood pressure, it's in blue because it's normal. So it's 110. It's 110 over 80 millimeters of mercury, which is mmHg. So then I have to explain to my patient. That all the vital signs are within normal. The temperature is 36.5, which is normal. Then the pulse rate is 65 beats per minute, it's normal. Respiratory rate 18 breaths per minute, it's normal. Blood pressure is 110 over 80 millimeters of mercury, which is normal. So there is nothing which is diverting from normal. All the vital signs are okay. Thank you very much for allowing me to do the procedure. Thank you, Ms. Kasapo. Okay. Okay, so for the vital signs now, this is how you do. Then what about what you used? So this has to be in a bin. You need to go and discard this in a bin, which is very good thing. And then also what remains there, you need to discard. If it's spirit, you have to put back. So thank you very much for watching and hope you have a pleasant day. Thank you very much. Later.